start tonight with a quick look back as we all continue to move forward. It was exactly 2 years ago tonight, March 14th, 2020, that the very first cases of coronavirus were confirmed in Erie County and Western New York. The breaking news tonight is that, as we have suspected, there are confirmed cases of the coronavirus now here in Erie County. There are 3 of them. This was found at the Erie County Public Health Lab. The results late today announced, and now the question becomes, what will happen with schools? Will there be a state of emergency? And what is, of course, the potential danger to the public as a result of this? Schools did close. We did have that state of emergency, and really everything changed. Now, 2 years later, after multiple waves, after a major vaccination effort, we had masking, unmasking, then masked again. Where are we now? We thought it was a good time to bring in Dr. Thomas Russo, Chief of Infectious Diseases at the University of Buffalo's Jacobs School of Medicine. Great to see you as always, Dr. Russo. And for once, we're talking about this sort of in a positive light. Cases are low, hospitalizations are low, immunity is high, whether from vaccination or prior infection. There is some talk right now about potentially other new variants, but how do you size up where we are at this moment in the pandemic?
Well, we're in a better place than we've been at any time during this pandemic, Michael. And as you mentioned, part of it is the immunity wall that we've built up due to the combination of vaccination and individuals that have been infected, particularly those that have been infected with Omicron. So in the short term, we're looking great. I'm really hoping that we'll have a good spring and summer. Weather will help, of course, as we head outdoors and get away from those indoor settings, which enhances spread. However, as we head into the cooler late fall and winter months, COVID has not left us. There's still going to be some COVID out there. And for those individuals that are still susceptible, particularly not vaccinated, or those that have a waning in immunity and haven't gotten their boosters, we will see another bump, I suspect, in the winter months. Of course, all of this assumes that some variant doesn't evolve that's able to evade the immunity that we've built up. And the variant we're most concerned with is a variant that not only could evade that immunity, but could cause severe disease that results in hospitalizations and bad outcomes.
Yeah, luckily the most recent variant of concern was super transmissible, but not as deadly, right? Didn't cause as much severe disease, talking about Omicron. So we'll follow that. Thankfully, COVID is not top of mind right now, but people do want to kind of stay ahead of the curve. So we wanted to ask you about these headlines in Europe that we're all seeing right now about, considerations in a lot of countries there about another booster dose. Even yesterday, the CEO of Pfizer came out and said a 4th shot is needed. What do you think about that and the timing of when we may see something like that?
Well, it remains to be seen whether we're going to need that 4th dose or not. I suspect at the end of the day, likely we will. Historically, we've learned that we do have some waning of our immunity over time, though whether that waning of immunity will be significant enough that will not protect us against severe disease, hospitalizations, bad outcomes remains to be seen. However, if we do need that 4th dose, and again, that'll be contingent on if we need that protection against the most severe outcomes, I expect that it'll likely be sometime similar to when we get our flu shots in the beginning of the respiratory virus season. So we're looking at sort of maybe the end of August, early September, at least trying to get that shot in our arms sometime before Halloween.
Dr. Russo, we mentioned that it has now been officially 2 years since those first cases in Erie County. Interestingly enough, since then, 213,000 additional people have tested positive just in Erie County, which has less than 1 million people. So it really does kind of put this in perspective, how many people have caught the virus. The good thing is that leads to a lot of immunity, and you touched on this. Vaccination adds immunity on top of that. Is what is going to hopefully kind of help us stay in this phase now of back to normality and not kind of go backwards like we did with some of these previous waves? Have we now built up enough immunity that we can avoid, the return to masks like we had to do before, the return to, social distancing and all these measures?
Yeah, Michael, every little bit of immunity helps. And obviously, the best means to achieve that immunity is through vaccination, because as we all know, this virus is unpredictable, potentially lethal. And I think the next phase after we get past this sort of acute pandemic phase is going to be the phase of consequences of infection, which is long COVID and potential long-term consequences. So again, vaccination is the way to go. If you're yet to be vaccinated or eligible for a booster, please do so to maximize that immunity in the safest possible fashion. Having said that, though, we have built up significant immunity since the combination of vaccination, and so many people have been infected. And again, that one wild card, similar to Omicron, hopefully a variant will not evolve that will evade that immunity wall that is developed and cause severe disease. So fingers crossed on that one. I am optimistic, but we've gotten a curveball or two in this pandemic, so we'll just have to wait and see how that plays out.
Yeah, there's no doubt about that. Finally, there's a lot that we don't know about the virus still, but we certainly know a heck of a lot more than we did 2 years ago, right? When we didn't really know anything and we were just starting this. We not only have vaccines now, but we also have therapeutics. And I know that there's been some frustration because it hasn't been widely available to get the easy pill that you can take if you're at higher risk, early on in the disease. But that's ramping up, right? Millions of doses of that becoming available. How much of a factor is that going to be as we hopefully continue toward the endemic phase of this, right? The pandemic finally ending.
All of this is going to be a huge help. We finally have those old treatments that we were long awaiting for, and they're going to become increasingly available. And Michael, I'm also hoping that we could maybe improve on our vaccines in the long run. Obviously, in the short term, our vaccines have served us well, and we want to continue getting those shots in arms. But looking down the line, we're developing vaccines that might better prevent infection. And maybe, the holy grail is that sort of pan-coronavirus vaccine that will be effective not only against the variants we know about, but variants yet to come. So we're in a great spot, and I think we'll continue to improve both on our treatments and our ways to prevent this disease moving forward.
I'm going to put you on the spot. What do you think are the chances that we get that vaccine, the catch-all vaccine that you're talking about?
Michael, I'm an optimist. You know that.
You are,
but,
the eternal.
I'm pretty confident we will. I think the one thing that this pandemic has taught us is the extraordinary technological advances in developing our vaccines, not only the extraordinary speed, but this huge breakthrough with the RNA vaccines. And so I really think that combined with other sort of scientific tools such structural biology to define parts of the virus that are constant and vulnerable will really result in the development of that vaccine. The key is we have to invest in it. If cases go down, we might have a short memory, and we have to remember that the risk is still ongoing and it might rear its ugly head again. So we can't give up on this, and we have to keep our foot on the gas and really see this all the way through.
Yeah, that technology now even being used, with cancer, with HIV/AIDS, and it seems like the opportunities are limitless. Dr. Thomas Russo is Chief of Infectious Diseases at UB's Medical School. Great to see you, Dr. Russo. Thank you.
Yeah, always great to be with you, Michael.